I practice the meditation, the more that becomes reliable. What happens is that over even a period of 8 weeks, but we've done up to 4 years of follow-up, symptoms drop, chronic pain drops, cardiac problems drop. People, recover from the cancers. I mean, gastrointestinal problems clear up. Not in everybody, but in at least 80% of people on average. And if you exercise that muscle, the muscle of mindfulness, of practice, when you feel like it, and even when you don't feel like it, as a discipline and as a love affair, over time, meditation practice formally becomes a part of their life, forever, not for 8 weeks, but forever. And then you discover that the real meditation practice isn't sitting on a meditation cushion, it's living your life moment by moment by moment, and that life itself is the real meditation practice.
Just this moment, just this breath, just this sitting here, just this being human, just this. When you come to meet Dr. Jon Kabat-Zinn, your mind should not wander to Korea or New York Street or think about lunch. You should be right here, right now. I came to Northampton to meet the honorary professor of the School of Medicine at the University of Massachusetts, the master of mindfulness, who founded MBSR, Mindfulness-Based Stress Reduction. Hello, Professor. 9 years ago, when you came to Seoul, Korea to conduct an MBSR workshop, I covered it. Great to see you.
Yes, again. Wonderful to see you again.
What is the most common stress among modern Americans? And if you have any impressive cases of an individual who through an 8-week MBSR program overcame illness or embarked on a new life, please share with us.
I think that in this particular moment, the Surgeon General of the United States says that the greatest ailment of Americans is loneliness. And loneliness, of course, is a root cause of depression and feelings of alienation. So what's missing in a certain way is a sense of connection, a sense of belonging. So rather than looking at loneliness itself as the root cause of the problem, the root cause of the problem, it seems to me, is disconnection. And when we have the people come to the MBSR program, to the stress reduction clinic at the University of Massachusetts Medical Center, they are referred by their doctors for every conceivable kind of medical problem, not mostly psychiatric problems, medical problems, but anxiety and depression are part of it. The feeling of loneliness may be part of a feeling disconnection. So there's a big difference in English, at least, between the word loneliness, which is a serious problem, an existential problem of longing, and aloneness, which is simply being who you are and at home in the present moment. So MBSR, the origin of MBSR was to bring mindfulness, which is the Buddhist meditative practice that cultivates the direct connection with wakefulness, with awareness, embodied awareness, into the mainstream of medicine. And in English, if you listen carefully, the words medicine and meditation sound a lot alike, and they are deeply, deeply connected. So in 1979, when I set up the MBSR clinic, the idea was to catch people with all sorts of medical conditions, not just depression, not just anxiety, but heart disease and cancer and chronic pain of all kinds, and invite them into a program that would help them connect with themselves, connection rather than disconnection, of course, with the world, but first you have to start close to home, so with yourself. So that's where the meditation practice comes in. You can think of it like disconnection leads to dysregulation, leads to dis-ease, whether at the level of the mind or at the level of the body. So connection would lead to improved regulation, biology, leading to ease or well-being or health. So, as I said, the words medicine and meditation sound a lot alike in English. And what medicine is the restoring of this kind of connectivity, of balance, to whatever degree is possible when you have some kind of medical problem. With drugs, with surgery, with therapies of one kind or another. Well, what is meditation in that? Well, meditation is the direct perception of right inward measure. In other words, of deep connection, of no matter what's wrong with you, for anybody who's still breathing, our view is there's more right with you than wrong with you, no matter what's wrong. And for MBSR, we take people with every conceivable medical diagnosis who would be willing to enter an 8-week course like this and ask them to do something for themselves as a complement to whatever medicine and their doctors and surgeons are doing for them, to move in this direction of greater well-being, greater connectedness. And we start with the body, because from the Buddhist perspective, in the Buddhist teachings, the body is the first foundation of mindfulness. Mm-hmm. And mindfulness, as the Buddha said, is the direct path to liberation from suffering. And suffering in English, from the Latin suffere, it means what you're carrying. So a lot of the time we're carrying a feeling of not being any good, of being lonely, of being not belonging, of there's something wrong with me. And those are very, very stressful. They're burdens. And the stress reduction program based on meditative training and mindfulness is to recognize that that's not who you are. So we go directly to who you are, the various foundations of mindfulness, and we discover what I just said, that there's more right with me than wrong with me, even if, today I walked in and walking is a big problem for me because I tripped last night in a yard trying to fix something in somebody else's house. So I didn't know what was going on, somebody else's backyard, and I fell. And this morning I couldn't walk after that very well, so I'm using a crutch. But whatever it is, now I have to work with that. So we try to accommodate whatever the challenges are and focus on the possibilities of learning from whatever happened, growing from that learning, having new insights, and then healing. So in 2 or 3 days, I'll probably be walking just fine again, because I didn't break anything. And then transformation, then in some sense, becoming more who you already are. So this is where the Dharma, the river of Dharma, meets the river of Western science and medicine. And together they are forming globally now in all the countries around the world a new kind of understanding of science, of the nature of mind, and of the nature of human well-being, both individually and in connection with each other, because we're very much social beings. So, and it's all in the service of reducing suffering. The Four Noble Truths, have everything to do with the nature of suffering and the potential for liberation from suffering. And the Hippocratic Oath in medicine is to first do no harm. And how would you know that you're doing harm unless you were aware, unless you were mindful? Okay, and so the Four Noble Truths and the Hippocratic Oath converge with the Bodhisattva vow, okay, within the Buddhist framework, to live one's life not for oneself, but to actually save all beings from suffering. That was the language that Sansanim used to teach us in, to save all beings from suffering. Of course, that's impossible. This is just your first question. Yeah. We're just getting started.
Yeah.
But this first question is very important.
But I am happy. Very good point.
Yeah? Okay. Because I know you want me to give you stories of individual people. But in a way, I can't do that. Because I was at the University of Massachusetts Medical Center for the years 1979 to 2000. So that's 21 years that I led the MBSR clinic, the stress reduction clinic. And now I've been away from the medical center for 23 years. So I don't have my finger on the pulse of the latest things that people are saying. I keep up with the research to some degree. But what I can tell you from my own perspective is that I went to California 2 weeks ago to an AI conference. And I'm sitting on the plane, and somebody walks by on the plane to take his seat, and he says, "Are you Jon Kabat-Zinn?" I said, "Yes." He said, "You changed my life."
Oh.
When in 1981 or 82, when we were just starting the MBSR program, our little group went out to eat at a Chinese restaurant in Worcester. And we're sitting there having lunch, and a man comes over, and he had written on a napkin. I have the napkin. I saved it. I put it in a little frame. You don't know this. He was sitting in the restaurant having lunch, and he saw us, and he was in my class. He wrote to me, "You don't remember me, but MBSR changed my life." So what I've learned over the years is that we see people with every conceivable medical diagnosis under the sun. Cancer, heart disease, chronic pain, whatever. The vast majority of people, at least 80%, say, "This has given me a new way to be in relationship with my body, with my mind, with my family, with my life." And the more I practice the meditation, the more that becomes reliable. If I stop practicing, after a while, the benefits go away. So there's this general principle that it doesn't matter what your diagnosis is. You could have headaches, you could have chronic back pain, you could have heart disease, you could have cancer of many different kinds. But what we know, and we take people in MBSR with every diagnosis you can imagine, medical diagnosis you can imagine, and we put them all together in the same room. So that's crazy from the point of view of medicine. Medicine is like finding specific treatments for every specific diagnosis. But we noticed over the years that everybody who comes into our room, referred by their doctors, have one thing in common, more than one thing in common. One, they're all breathing. Two, they all have bodies. Three, they're all capable of awareness. And that's where mindfulness does its work, okay, with what's right with people. And then we let the medical center take care of what's wrong with people and see what happens. And what happens is that over even a period of 8 weeks, but we've done up to 4 years of follow-up, symptoms drop, chronic pain drops, cardiac problems drop. People, recover from the cancers. I mean, gastrointestinal problems clear up. Not in everybody, but in at least 80% of people on average, people report after 8 weeks that they are doing much better, and then it's true 3 or 4 years later when we follow up. So we now know that MBSR, or mindfulness-based cognitive therapy, which developed out of MBSR, or mindfulness-based childbirth and parenting, or any number of other programs based on the MBSR format, can take regular people who have no interest in meditation, train them in meditative awareness or mindfulness. And my working definition of mindfulness is that, one, it's pure awareness. Mindfulness is just pure awareness, that's simple. But if you want more words, it's the awareness that arises from paying attention on purpose in the present moment, non-judgmentally. That's the kind of instrumental definition of it. That turns out to be very hard because people's minds are crazy all over the place, all of our minds, so they don't stay put, they're not tamed. And so the meditation practice is a kind of taming of the mind. When it goes off, we bring it back. When it goes off, we bring it back. And we notice what's on our minds, and we learn and we grow from seeing how crazy our minds are, and then letting it go without believing all the stories and dropping into pure awareness in the present moment, which is in some sense outside of time. So since then, MBSR has spread around the world, and it's in major hospitals all over, the world, and which is really a remarkable unfolding, and very much in alignment with the potential for not just healing ourselves, but in some sense also healing society, because society is one of our major stressors. What's going on in the world in terms of wars, conflicts of one kind or another, the challenges of just living one's life. You mentioned that depression is a very big problem among the elderly in Korea, and anxiety is a very big problem among the young people in Korea. So there's no particular formula for fixing anxiety or fixing depression, but you could ask, who is anxious? Who is depressed? And all of a sudden things become very interesting, because then you get to inquire, you get to look and see and feel, who is it that is anxious? Who is it that is depressed?
Yes, yeah.
And when you inquire in that way, you don't know who it is. When you inquire, who am I? You're not your name, you're not your age, you're not your history, you're not your medical diagnosis, you're something, that. Everybody knows that. I'm bigger than all of that. Well, when you come right down to it, maybe who you are is pure awareness, and not your story about who you are and how depressed or lonely or anxious or sick you are. That's liberating. Instantly, not like 20 years of meditation, then you'll be somewhat freer or better or less stressed. Right in that moment, you have profound insight, profound understanding. And if you exercise that muscle, the muscle of mindfulness, of practice, when you feel like it, and even when you don't feel like it, as a discipline and as a love affair, over time, meditation practice formally becomes a part of their life forever, not for 8 weeks, but forever. And then you discover that the real meditation practice isn't sitting on a meditation cushion, it's living your life moment by moment by moment, and that life itself is the real meditation practice. So there's a lot more to say, but I'll let him go to question 2.
MBSR help us at first body, and then breathe, and then awareness, and then who am I? No pain.
Well, you may be feeling, pain is a very interesting question, because it's like there's pain and then there's suffering.
Suffering.
Same or different? Mm-hmm. Obviously, they're different. Mm-hmm. So pain is a kind of sensation in the body. Mm-hmm. Most people, when they have pain, they want to immediately take some drug make the pain go away. Make the pain go away. Anything. Surgery, just make the pain go away. Nobody wants to actually investigate the pain and ask, what is this? That when you do investigate the pain, of course, if you can make the pain go away with aspirin or whatever, great, or surgery. But a lot of time people have had 4 back surgeries and they just get more and more pain. And then they can't do any more surgery. The drugs don't work, or the drugs are, they're using narcotics, which people don't want to use. They're terrible. So then you're, what we say in English is, you're at the end of your rope. There's no place else to go. That's very, very good motivation for meditation. You have no other choice, no other place to go. Okay, maybe I'll just surrender and investigate the present moment. So then you can ask yourself, you instead of running away from the sensation, you investigate where the sensation is and where it's most intense. And you see if you can breathe with it. Just even one in-breath, one out-breath. Am I dead yet? No. Okay. Maybe another. And you begin to learn that you can hold what we call pain. Maybe it's not wise to call it pain. Maybe we call it intense sensation or intense discomfort. When you call it pain, that has a lot of baggage associated with it. And it seems like, well, I can't do anything. I have to get someone to cut it out or some drug. But if you think of it as intense sensation, it's workable. So then you can befriend the sensations a little bit, like if you jumping into a swimming pool. Maybe you just put your little toe in the water, woo, and then maybe a little bit more, and then finally you can go in or into the ocean. So this is the way we differentiate pain from suffering. And the pain's not the problem, it's the suffering that's the problem. So this is something that you might think, well, Buddhist monastics might understand that, but not ordinary people. But what MBSR showed, ordinary people can understand this, sometimes better than the monastics, because it's not theory. It's like, I have this problem or that problem. So they're highly motivated when they can't get any solution, highly motivated to take responsibility for the relationship themselves. And then you can liberate pain from suffering, separate the two. And then you might have intense sensation. Maybe you shouldn't even call it pain, but you work around it. Like you see, I'm walking in on crutches. I have a lot of pain in my hip at the moment from having fallen yesterday. And it's just like, okay, I mean, it could be worse, it could be better, but right now that's what it is. And so I work with it, but I don't let it define me, at all. And so this is a way in which medicine and meditation have come together so that it can be a participatory medicine. The patients can participate in their own healing by cultivating mindfulness moment by moment by moment, in addition or as a complement to whatever surgery or drugs or care that the hospitals and doctors can provide. And that's changed medicine already in 44 years now. It's changed psychiatry. It's changed psychotherapy because it has brought the individual human being back into the center of things and invites them to participate in profound ways at mobilizing their deepest and most beautiful, we could say in a Buddhist terminology, Buddha nature, and in a kind of more Western terminology, interior resources for learning, growing, healing, and transformation. But it all has to do with the fundamental question, who am I or what am I? And then learning how to listen, not to fill it up with answers, but to listen deeply to the questioning, the inquiry. And that listening is a form of awareness. That's awareness. We can be aware with our eyes, our ears, our nose, our tongue, and also body, mind. There's an instrument of awareness, of sensitivity. And then we can be aware of awareness itself. So this is a huge human mystery Huge human mystery. No neuroscientist can tell you how you get awareness out of trillions of synaptic connections in the brain. We just don't know how you go from cells and neurons to sentience, sentient beings. But so that's a kind of mystery, but it's also a beautiful opportunity for people to not get depressed, to not get anxious, to not believe their stories of how bad they are or how troubled they are, and to maybe turn it around and say how beautiful they are. I mean, how much they are like a flower, and that the world needs all its flowers, not just a few here and a few there, but every single flower is a beautiful manifestation of living. And if people can understand that in 8 weeks and then practice, hopefully for the rest of their life, that's, again, an interesting confluence of science and medicine with Dharma, ancient wisdom, not just Buddhist, but the Buddhists articulated it in a very, very refined and beautiful way. And this may have implications for the world, not just for medicine, because the world is suffering. The world, we've given the world a fever, to just take one example. And we are creating problems for the planet that will affect future generations unless we wake up and then modulate our behavior at a corporate level, at every level possible, governmental level of warfare, because war is not just killing, it's also incredibly polluting. Every bomb that's dropped is full of horrible chemicals and so forth. So like, this is time on the planet for, in some sense, Dharma medicine to heal the world, not just individual human beings. And for the species, human, what we call in English or in Latin, Homo sapiens sapiens, the species, that means the species that is aware and is aware that it's aware. It's quite a name. Linnaeus gave us that name. But I think our karmic assignment or our dharmic assignment as human beings as a species is to live our way into that name. And we don't have a lot of time because we're so crazy and so violent. So we need to, that would be medicine for the world.
I got it. You wounded your leg yesterday.
Yeah.
You have pain, but no suffering.
Yeah.
You have awareness.
Yeah, you got it.